Well, kia ora koutou katoa, no mai haere mai ki te manatu hauora. Welcome back. We're in a slightly different venue here today, but thank you for attending the update today. There are 4 new cases of COVID-19 to report, all detected in recent returnees, and they are all in managed isolation facilities. There are no new cases in the community. The first of the cases reported today arrived on the 27th of October from Austria via Qatar and Australia. The person returned a positive test at around day 12 of their stay in managed isolation. The second and third cases being reported travelled together, arriving in New Zealand on the 5th of November from Dubai, and they returned positive tests at around day 3 of their stay here. The fourth case reported arrived on the 5th of November from Qatar, and also tested positive at their testing at around day 3. So these 4 people are now all in the Auckland quarantine facility. Furthermore, one previously reported case has now recovered, and our total number of active cases in New Zealand is 51. Our total number of confirmed cases since the outbreak commenced back in February is 1,630. And yesterday, our laboratories processed 3,042 tests, and our grand total to date is 1,139,978. An update now on what we are calling the November quarantine cluster. So these are the 2 cases we have reported in the last few people who work for the New Zealand Defence Force. The first is Defence Force worker, which we are calling Case A, at the moment at the Auckland quarantine facility. The genome sequencing conducted over the weekend shows a direct link to 2 recent returnees who are part of a family group in the quarantine facility in Auckland. Whilst we have not yet determined the source of the exposure, this does confirm that this case's infection has arisen in the course of their work in the facility, not more widely in the community, and our investigation is ongoing as to the actual source of the infection. Now, in terms of Case A, they are accommodated in a place where other defence staff are in Auckland when they are on duty, with a total of 242 occupants there, and 239 of those people have returned negative tests already, and 3 are pending. Of the 5 close contacts of Defence Worker Case A, 23 have returned a negative result. 1 result is pending, and 1 other close contact, as was notified over the weekend, has returned a positive result, and that person we're calling Defence Force Worker Case B. That person has 55 close contacts, and of these, 32 have returned a negative test result. Others haven't been tested yet because they will be tested at around day 4 and 5. Some are self-isolating at home, while others are actually also in the quarantine facility because of the nature of their work, and will be managed there or isolated there and tested there. Case B also has 3 household contacts. All have returned an initial negative test result, and all will remain in isolation for the full 14-day period and be retested. These household contacts include 2 students who attend 2 different schools here in Lower Hutt, Bulcott Primary and Hutt Intermediate. The students, as I said, are in isolation and have been tested once already and returned a negative result. They have not been at school since Friday, and as a precaution, as I said, they will remain in isolation for 14 days. Parents, caregivers and staff at those schools will be in the process of receiving a letter around this. And as advised in the letter, other students and staff at those schools do not need to be tested or to self-isolate. They will just be asked to keep an eye on symptoms, be tested if they develop symptoms, but they're considered to be at very low risk, given that both students have already returned a negative test result. Of the 9 close contacts identified on flight NZ457 from Auckland to Wellington on Thursday evening, that was the flight that Case B was on, 7 have already returned a negative test, and the remaining results are pending as close contacts, people who were seated within the rows. In this case, they will be in 14 days isolation and be There is another person who is a casual contact. They weren't seated near the person, and they're now feeling unwell and is being tested. That person is reported to have attended a recent meeting in Kawhia, along with members of the Otorohanga College community and public health staff in Waikato have been in touch with that school. Our assessment at the moment is that people at that meeting should just be vigilant about their health. Of course, if they develop symptoms, as for any of us, they should get tested, but no further action is required at this stage. Just to emphasise, this was a casual contact of the case subsequently identified as Case B on that flight from Auckland to Wellington. The person who attended the meetings is not a case themselves. We're expecting a test result on that person later today. So push notifications were sent out through our app yesterday for locations of interest, and we continue to use the app to do this. Our thoughts are, of course, with the two people who have been confirmed as cases, and hope and wish them a speedy recovery. We're grateful to them and their contacts for moving so quickly to contain any further spread of the virus once it was discovered. And more broadly, I would like to reiterate our gratitude to all those who are working in our managed isolation and quarantine facilities. We've had more than 70,000 people now through them since the system began in March, and they are on the front line. The workers there are on the front line of our efforts to protect all New Zealanders from this virus. So please do remember how important the work of their staff is, and show these people your gratitude should the opportunity arise. Finally, onto the app, 2,345,700 registered users. It's about 58% of our adult population. And to date, around 50 app users have received contact alerts through the app as a result of yesterday's push notifications. A reminder, the importance of using the app to scan QR codes when you visit premises, and that helps us ensure that people are notified promptly. You never know where or when that information may be useful, and I continue to encourage everybody to use the app. And as we've seen, a number of other countries overseas are using this QR code-based scanning as a fundamental part of their contact tracing system as well. I am happy to take questions.
Another worker infected. What is being done to stop this happening?
Well, an enormous amount has been done to stop it happening in the first place, and that includes, of course, the very strict infection prevention control procedures in place in every one of the over 30 facilities. There's, of course, the regular testing that is done of staff, and in this case, the person who was infected, who we first identified, had been tested 2 days earlier. All those working in quarantine facilities are tested weekly and returned a negative test. So that is another layer of protection. But the key point here is, with each of these cases, of course, we do a very thorough root cause analysis and go back and find out where is it that possibly this breach could have occurred, and what does that mean for our overall protocols across our system. But again, just a reminder, I've made it before, that over 70,000 people through, many thousands of workers, hundreds of thousands of interactions, and that's why the term is infection prevention and control. And clearly part of our control process is to make sure we have really rapid responses if there is, and very occasionally there is, a breach.
How many push notifications went out to the places here?
So in total, from most recently, there was about 50 app users who had registered at those places. Now, I don't know what proportion of people that was actually visiting the premises. However, I'd be very keen to know that it was 100% of people. I doubt it is on this occasion, and I'm, again, just encouraging people to continue to use the app. You don't know when that interaction is, that with somebody, you'll never know. So the idea is it's like using a seatbelt. Safety first, prevention first.
Did you make contact tracing compulsory, and what powers did you be able to use?
Well, actually, the mainstay of contact tracing is the work that the teams in the public health units and our team here do in following up people. And in fact, it is in a sense compulsory for people to follow the instructions that are given to isolate and be tested. In terms of use of the app, there is of course an obligation on all premises to display the QR code in whichever alert level we are in. Currently in alert level 1, scanning in is not compulsory, and that's not currently being contemplated, but it's still something that could be obviously further looked at in the future.
Yeah, I mean, if we see more of these little mini outbreaks pop up, not outbreaks, but cases pop up, is that going to be on the cards in the future to make scanning compulsory under Alert Level 1?
Again, it's something that's on the table, but alongside all the other things we are asking every New Zealander to do. Don't go out if you're unwell. Get a test if you're unwell. Hygiene. Use the app and scan whenever you see a QR code.
And so what time did case A test positive on Friday?
I can't remember the exact time. In fact, the test of case A was taken on Thursday afternoon, and the result came back Friday.
Friday morning?
The result came back early Friday afternoon.
Okay,
Yes.
and so with case B, what time did that positive test come back?
So case B is a close contact of the first case. They were in a meeting together on the Wednesday. So as soon as we knew about case A, when the test result came back on Friday afternoon, the public health unit and our team here worked right through Friday afternoon and evening to identify all the close contacts, get them isolated and test them. And then the result back from that case B came back over the weekend. I can't remember the exact timing.
This is the COVID response team, close contacts with the cases?
No members of the close contact of the COVID response team are. One of our ministry staff members was on the flight back from Auckland, and as a close contact has been followed up along with everybody else and is isolating and has been tested already. Please do.
Can you tell us more about case A's nature of work? Did they have direct interaction with the residents, or is it more likely to be like transmission? I assume
It's
security details, other than like nurses who have direct interaction.
Yeah, so two comments here. First of all, they are one of the Defence Force staff there who are involved in supporting all the work that happens there. And that may sometimes involve interaction with the people staying there, whether it's overseeing them moving out of their room, for example, for exercise, or if anyone smokes, that could be part of it. The second point here is, yes, it's the health staff who are more likely to have regular interaction with the daily health checks and swabbing with those who are in the quarantine facilities. The other point I would make is these last 3 cases we've seen amongst workers in managed isolation and quarantine have occurred in quarantine facilities, not in our general managed isolation facilities, remembering that anyone who is symptomatic or tests positive in a managed isolation facility is immediately moved to a quarantine facility. So yes, the risk is higher for those working in quarantine facilities, and that's why they're tested weekly rather than fortnightly.
What are your thoughts about using N95 masks, surgical masks, all those workers that interact in those quarantine rooms?
That's one of the things we're looking very specifically at actually right at this point, because it may well be that as the evidence emerges about this virus, that we find from our experience here that there is a higher risk of just general, perhaps aerosolized virus, and that may mean that those workers who are having more regular interaction with people who are known to be infected should be using N95 masks, and we're having a really rapid look at that right now.
Would it be a more better precautionary approach to have that as the starting point rather than the surgical one?
You mean before we knew?
I mean, just now, from now, just have that, or are they better at blocking potential transmission than the surgical mask, or is it circumstance dependent?
Well, they are definitely better, and the use of masks at the moment is based on the best advice we have from our infection prevention control experts. But this specific issue, in response to what we have learned from these last few cases, especially where there doesn't seem to be any obvious close contact or lengthy contact, but just that some of the workers are having quite regular contact with infected people. This is exactly one of the things. So we will seek and act on any further advice around use of N95 masks.
Bloomfield, we've been told from a man on the plane in row 23 near the infected case. He was told by the Ministry of Health he was a casual contact and he didn't need to isolate or get a test. Then Healthline told him he was actually a close contact, and then the advice changed again and they were told they were a casual. Why is there this level of confusion?
Well, actually, it would have been the public health unit who was contacting him, and they would have been making an assessment of all the people on the flight and giving the advice. It may well be that the Healthline the specific person on Healthline wasn't aware of what that latest advice was, but I'm pleased that the individual then went back and clarified. And I would recommend for anyone who's contacted by the Public Health Unit or our contact tracing team, they will have done a risk assessment and their advice will be what to follow.
Has wrong advice been given to anyone else?
Well, I don't know if wrong advice here. I think what you're raising is that there was conflicting advice and that this person did exactly the right thing. They clarified with the original advice that they had received, clarified that advice and got a good steer there.
Do you think there's something wrong with order processes, considering this is the 7th order failure we've had since August?
Well, I'll just, of course, have to respond around the use of the word failure, as I do. I think what we've seen is that we know there will be and expect that there, despite all our precautions, there will be the odd incursion, and that's why we have a series of systems in place to not only detect it early, but then to follow up quickly. And you'll have seen with all our recent, we've been able to get around them very quickly, and that is again our aim here. 24 to 48 hours, we'll have a really good picture of the extent to which we've been successful in this.
Sorry, just one more question. Do Defence Force personnel who work at the borders have a policy of wearing masks when they travel on aircraft and public transport?
I couldn't say, actually. I don't know the answer to that, but we can find that out.
And if
Yeah.
there's not a policy, do you think there should be a policy?
Well, what I would say, what I would do is go back to the advice I've given to all New Zealanders, and it's advice, I take my own advice on this one. If you're taking public transport or flying, use a mask. We've done it under Alert Level 2, and just do it. And again, in this situation, if someone was seated near this person who became a case and may have been infectious, the fact that if they had been wearing a mask, that would give them a high level of assurance that even though they're a close contact, they would likely have prevented any possible infection. I'll just go.
Given the staff that works in a higher risk environment in a managed isolation facility, is it appropriate that they then meet outside staff and have face-to-face meetings?
Yeah, this is one of the things we'll be looking at. In fact, it came up in our discussion with our defence colleagues this morning. Again, it's something in every one of these situations, we look at all the circumstances, and it may well be that we change the protocols around who those working, especially in the quarantine situation where there is a higher risk, whether they attend face-to-face meetings during the period of their posting to a quarantine facility, or whether they in fact just participate in those meetings remotely through Zoom or similar.
Well, I mean, instinctively though, surely you would say that no, they shouldn't attend a face-to-face meeting.
Yeah, well, we'll have a look at it. Remembering that there is a range of measures in place that includes the regular testing, and in this case, the worker had been tested just 2 days earlier and returned a negative test.
We talked about because they were taking case A and case B to keep themselves safe. Because I mean, just following up on that and putting it another way, that's a person who is working in a place that has all of the COVID in the country, meeting with someone who then coming back to the defence house, somebody a nerve centre for important work they have to get in this country, and that have passed that along. Surely on it should never have happened at all. I mean, would it follow for you this protocol and so on and so forth? It seems instinctively bizarre.
Yeah, well, obviously, that's one of the things that we're looking at. And you can imagine my Defence Force colleagues are very keen to look at that, because the follow-up has required them to close Defence headquarters here and deep clean it. It's required a number of their other staff members to be stood down as close contacts. What I would say, though, and this was raised in discussion with colleagues this morning, is that the movements of these staff working in managed isolation and quarantine, that is the Defence Force staff posted, are already limited. They don't tend to be going out a lot. So yes, they have to eat, and they obviously like to meet the odd person for some socialising, but they're not routinely moving around a lot, because they're on these postings. They are staffing the facilities 24/7, so they're on 8-hour shifts the whole time, and they're on postings for several months at a time.
Just one follow-up question, if that's okay. That with other managers being told that their case B was in a longer than 2-hour meeting with more than a dozen people, can you confirm whether that's true and what's happening with those people?
Yes, I understand there was another meeting on Thursday with other Defence Force people. That was, I think, a training session, and all the people at that meeting have been identified and have been treated as close contacts and isolated and tested.
Please. Some questions. Thank you. So we have many groups in Wellington now. It's been how many months since our last case? What's your, guidance or reassurance for school parents, everyone, about
Yes.
this now being back in the capital?
Well, at the moment, we know we have one case, and that person is now in quarantine. We've acted rapidly over the weekend to identify, isolate, and test close contacts. So far, that testing has not identified any further spread. We've, as we do also, routinely notified all the locations, whether they're community settings like schools and or retail or other premises, eating premises, that they may have had someone there. We've used the app to notify people. So I guess my message to Wellingtonians and all New Zealanders is, so at the moment, this looks well contained. We will continue to update people, and in the meantime, carry on with our normal Alert Level 1 actions, which are around not going out or to work if unwell, being tested, and using the app regularly.
Are you
Just like to
comfortable?
turn to managed isolation, please. So, to your knowledge, does modelling show that there is a rush home for Christmas from people overseas?
Well, it's not even modelling. It's the extent to which the vouchers that are now required to have anyone travelling from overseas is required to have a voucher for managed isolation. So there's been huge demand for those, and I'm not surprised. I think people are wanting to come back to New Zealand, and many are coming back more permanently, but some, of course, wanting to come back and spend time with family for Christmas, and that's understandable.
Yeah, of course, it's not unexpected. But why don't we make more managed isolation facilities available to deal with that demand?
Yeah, so just remembering there are already between 6,000 and 7,000 places available at any time. That's a significant number, and in fact, you may be aware that that's quite a lot more on a per capita basis than, for example, Australia has had. And the team overseeing those facilities works very hard to ensure as many of those places as possible are available for people to use coming back from overseas. And I know, having spoken with them this morning, that if any further places do become available, they will be prioritised for New Zealanders who are wanting to get home ahead of Christmas.
Are you
The
comfortable?
person who went to the coffee at the weekend, whose test result you're waiting today, do they have COVID symptoms? Or do they have some symptoms?
They reported having some symptoms, and that's why they've been tested. They had been notified they were a casual contact because they were on that flight, but not seated anywhere near the person who's subsequently become a case. Remembering too that when that person took the flight back from Auckland, that they were not symptomatic and in fact didn't develop symptoms until later on Friday evening.
Do you know that the defence civilian with the war mask on?
They didn't wear a mask. I do know that.
Did
Are
you
you-
mention the Māori Women's Welfare League meeting linked to that Aotearoa connection? Did you talk about the person, this casual contact that is now seemingly sick, also attending a Māori Women's Welfare League meeting?
No, I didn't, and I don't have any. I don't have any information. I know that the person attended a meeting in Kawhia, at which there were people who were associated with Otorohanga College, and I think the college itself has sent a message out today, and so, but I don't have any information about whether that was specifically a Māori Women's Welfare League
If it
meeting.
was another separate meeting, let's just say that it would be casual contacts.
Yes, potentially casual contacts, and the advice there, of course, is to just be aware of potential symptoms and seek a test immediately.
Are you comfortable with Little Penang reopening today, and then of course the Defence House and Mojo Cafe being open today as well, considering the Defence House has been shut down?
Yes, I think the protocols are well known and are followed by these establishments, and they do what's called a deep clean, and then can reopen once that's been undertaken. And obviously the restaurant, if it's been able to do that and reopen, that's fine.
On the nurses' strike, will that have any effect on fighting COVID?
Well, we're working very hard to make sure that isn't the case. Obviously, that's these the primary care nurses and those who work as administrators in primary care are a critical part of the primary care team, have been a critical part of the overall effort in response to COVID-19 this year, and I want to acknowledge that. And just on that note, and I just want to say that I've personally been involved in working with primary care and district health boards over the last few weeks to not just understand the issues, but look at how we can resolve them. And the main issue here and what's causing concern for these primary care staff is that a gap has opened up between their own pay rates and those of DHB employed nursing and administrative staff. And it's understandable that they are concerned about that and are looking for a solution to address that gap.
Dr. Bloomfield, would you
Sorry,
like
just
to
a question
see-
here.
Is it time for another review of infection control protocols in the facilities?
Well, we're doing that all the time, and in particular,
So like a
doing a rapid review. And we're doing, yes, and as part of our follow-up, in particular on the Sedema Hotel situation where we had the big group of travellers from overseas and then quite a number infected, and then two infected workers out of that. We're having a very good look at the whole infection prevention control side of things, and then doing another round of audits over the next month of all the facilities across the country.
And is it time for a review of whether masks should be mandatory on aeroplanes at a one?
Well, at the moment, I'll just go back to my strong advice to New Zealanders to use them.
That's a holding statement.
I think it's good advice, and you've heard Minister Hipkins say already that that's at the moment the government decision is not to make them mandatory, but it will be something that will be constantly reviewed. Reviewed our masks policy right since the beginning.
Providing the new cap on that matter?
We've already provided advice to the government, the previous government, on this issue, and
Is it your
if we're requested, if we're asked for further advice, I think the minister's clear on what our advice is. But of course, ministers are weighing up a whole range of different issues.
Just quickly,
Can you
if I
share
can,
what your advice is?
are you aware of any efforts, or has the Health Ministry been asked to look at any further options to expanding the MIQ system?
Not at this point in time. Just remembering also that we are putting a lot of work in with our colleagues across government around possible safe travel zones. 40% of the people coming from abroad into managed isolation are coming from Australia. And so if we moved in the direction of a safe travel zone with Australia, that of course would free up considerable capacity in our managed isolation facilities. But at this point, from both a health system and I think a wider government perspective, we think that we've reached about our capacity in terms of our ability to staff the facilities.
In regard to the safe travel zones, then, I mean, is it your view that the threshold for opening up to Australia would be 28 days of no community transmission in the state, say like New South Wales?
Yes, so it's 28 days of no community transmission where the source is unknown. But so saying, we're going to discuss that again with our Australian counterparts, because that position was reached in July, and clearly we've had a lot of experience since then. So we're just going to test and see, actually, that's because it's a high bar, and rightly, we want to keep New Zealanders safe. We don't want to increase the risk, but it may well be, given what we've learnt since July, that we could look at whether or not that's still an appropriate requirement on both countries. Because if we are going to move to a safe travel zone, it also needs to be doable rather than just constantly being deferred.
Dr. Bloomfield, is it your preference that masks would be mandatory on public transport?
Well, the advice I've given the minister is consistent with the advice I'm giving the New Zealand public, which is to use a mask on public transport and on flights, even in alert level 1.
So you'd want to see it mandatory though as well?
Well, at the moment, I've given my advice. The minister has commented that the government doesn't have the intention at the moment of making it mandatory, just as it doesn't have the intention at the moment of requiring people to scan and using the QR codes. But all these things are on the table, and our response to date, and now, but in the past and in the future, will be good if we keep adapting and learning from what happens. And so, just because they're not happening now doesn't mean they're off the table for good.
I'm just trying to ascertain, and if it's not something you want to share, that just say, but is your advice, you say you want people to wear them, but is your advice for them to be mandatory for people to wear them, or just people should wear them?
Yeah, so I have given advice that that is consistent with my advice to the public, which is to wear a mask on public transport and to wear a mask on flights. And yes, and in fact, I've been asked about this with the minister. Our advice has been, we think there is a case for making them mandatory under alert level 1. To date, that's not the decision the government's made.
How irresponsible is it of a Defence Force worker to meet with someone from a managed isolation facility and then go on a plane and not wear a mask?
Look, I don't think it's irresponsible in and of itself. I just want to go back to the comments I made. all the people involved here have been fantastic in responding rapidly and in isolating and being tested and quickly close contacts, so those people could be isolated and tested. And so, like us, and like all of us, they will be learning from this experience, and it's what we do next that matters.
Do you have any further updates on each of those cases where infections have come from MIQ into the community? The latest updates on how those infections were transmitted. So we know, like, for example, the Lifton Bridges case, the shared rubbish bin in the Crown Plaza, I think. There was questions about the Savannah Seville, and then we have the Sedema cases. What's the latest about how those?
I don't have a concise update on those, but I'm suggesting we'll do that this week. So I'll ask the team if we can at least give an update. What I do understand is that on the Savannah Seville, it's almost certainly some interaction between the original, the worker who was the first case, and the onboarding captain, who was one of the people who was joining the vessel. Now, I'm not sure though of the exact circumstances. From the Philippines, that's correct. And in the Sedema case, there's no, and I was down in Christchurch on Friday, there's no obvious interaction between the two workers, recalling that they have different genome types with a specific individual, and so that in and of itself is also instructive in terms of what we might do next in further strengthening our infection prevention control procedures. But we will give an update this week on those ones and also these most recent ones. Did you have a question? No? Final question?
Just, are you happy with the way the communications have come out of Oklahoma College today? There was unrest, I guess you'd say, in the community, and maybe the way the information that they put out initially was not correct, and that might make some fears. Do you have some message for the community and the way that the school runs?
Well, I think the key message for the community is we've provided the information here at the stand up, and the public health unit will be following that up as well. I think the intent around getting information out to the community, which is something we're trying to do speedily, is good, and it's important that the information is accurate. And I can point people to the information the public health unit will be giving, and the information in our updates, including our briefings like this, will be accurate, and it's designed to ensure everyone has the information and that we can reassure them.
And just in terms of them moving ahead of the Ministry of Health and the public health areas, they were putting information ahead of you guys, and it was partially incorrect. Do you have advice for other principals or other people in the community who might be in the same situation about how to best proceed so that it doesn't lead to incorrect information?
Well, my main comment there would be we'll often see information getting out, often through social media, which is then monitored by yourselves and mainstream media, and that then is preempting our release of information. What we're trying to do now, as we have all along, is get that information out, and you will have seen us getting the information out quite quickly after we are notified of cases, and not waiting till 1 o'clock the next day. And this is so that people have accurate information as early as possible, and we'll keep doing that. Thanks very much.
Thank you very much.